The main thing I do is advocate for patients. All of my patients are people who have been admitted to the hospital either more than 3 times in 1 year or have more than 2 terminal diagnoses. So things that are never going to go away. A lot of my patients have diabetes, high blood pressure, histories of strokes, heart attacks. And then when I meet with them, the first thing that we do is have to go over this paperwork, and it's called a patient survey. But what it does is it helps me find out what they need help with, instead of me sitting down and saying, so what do you need help with? And then the one that landed me in the position I am in now with this is your diet basically. And one of the questions is, do you follow the diet that goes along with your diagnosis? Okay. And I had been doing this job for 1.5 years before I had this patient answer it honestly the first time I asked it. And then I asked if she gets food stamps because, or the EBT or SNAP benefits, a lot of different names for it now. And she does, but she only gets $20 a month. So she was feeding herself on $4 a week. So I asked, the main thing I do is advocate for patients. All of my patients are people who have been admitted to the hospital either more than 3 times in 1 year or have more than 2 terminal diagnoses. So things that are never going to go away. A lot of my patients have diabetes, high blood pressure, histories of strokes, heart attacks. And then when I meet with them, the first thing that we do is have to go over this paperwork, and it's called a patient survey. And it's 12 pages long, and I think it's like 34 questions. Wow. And it's kind of daunting the first time you meet them, because you're like, hey, I don't know you at all. Tell me everything about you. What do you eat? And she's like, I eat a lot of ramen, a lot of Campbell soups, and so much of my job is education. But how can I tell this woman to stop eating those things if she can't afford it? So I got home, and it made me think, are my other patients having this problem? They've never said anything, but I can understand why you would not answer that question honestly the first time you're meeting a stranger. So yeah, it was just, and these aren't people, like, a lot of times I think people who hear that people are on food stamps or SNAP or whatever think it's like they're unemployed, they're have a drug problem or whatever. These are senior citizens who have either worked their entire lives or raised their family as their husbands worked their entire lives. None of my patients have any sort of history of any of that kind of thing. It's such a stigma.
It is.
So I asked my husband, because I knew I couldn't do it. I was like, how do you feel about doubling the size of the garden? And I'd like to plant some plants and just donate everything to my patients, and whatever's left over, I found out the food bank of Norfolk accepts fresh produce.
Didn't know that.
Yeah.
That's fantastic.
Not a lot of them do.
No.
But on their website, it says that they do. So I figured whatever was left over, I could give to them. This year, when I realized I wanted it to be more than just me giving to my patients in my yard, and I started the Facebook page because my goal is for next year is to get more Navy wives involved with it.
Yeah.
To whether it's just planting a couple of high yield plants in pots in your backyard and donating to your time seasoned neighbors or donating to the food bank.